Then you have on the ectopic pregnancy front, and Greg and I were talking about this in the green room. Yeah, people didn't talk about ectopic pregnancies and the treatment for it before because it wasn't an issue before. But now
Still
if you look at it, it is an issue. If you look at what's going on in a state like Missouri,
grabbing straws.
Grabbing straws. One person who is denied medical care for an ectopic pregnancy makes the entire point of this moot.
Well, Katie,
if a woman dies from it is going to happen because you have to call somebody. If you're a doctor, you have to get permission to treat someone for something that happens quite rarely, actually, when you look at, quite frequently when you look at the statistics for it. That is it's a major sin of this ruling, that leaving this up to states.
I have to respond.
I wouldn't bring up sin when we're talking about abortion.
I have to respond.
Use ectopic pregnancy when a fertilized egg implants outside the uterus. This is in theory excluded from the abortion ban in Texas, but what are you hearing in practice is happening in that instance?
Exactly. Even an ectopic pregnancy, which seemingly is excluded, falls into a gray area which can be interpreted differently depending on where the person shows up. So most commonly, an ectopic pregnancy might implant in the fallopian tubes or in the ovaries, but an ectopic pregnancy can also implant into a C-section scar or into a uterine scar from a prior surgery. That pregnancy will then grow through the uterine scar, potentially outside of the uterus and into the bladder. Even before this ban went into effect, there were hospitals in Texas that would refuse to care for someone with an ectopic in the C-section scar because they weren't sure if it was actually an ectopic or not. And so what we are seeing now is that more and more people are being denied care for these gray areas that are not as clear cut because that decision-making is very individualized. It can't be clearly defined in a law. This is a complication and this is not a complication. This is near death and this is not near death. That is very individual.